A new study out of Yale University has sent shockwaves through the medical community and beyond. This groundbreaking research has opened up a Pandora's box of questions and concerns, suggesting a potential link between COVID-19 vaccines and a range of significant health changes. These changes, often debilitating, have upended the lives of countless individuals. The study has brought to light a series of health issues that were previously unrecognized or dismissed, causing a ripple effect of anxiety and uncertainty among both the vaccinated and unvaccinated populations. The health changes reported range from mild to severe, affecting various systems in the body. Some individuals have experienced chronic fatigue, neurological issues, and even autoimmune disorders. These symptoms have not only impacted their physical health, but also their mental well-being, leading to a significant decline in their quality of life. While the scientific community grapples with the implications, the human cost of this emerging health crisis is becoming increasingly clear. Families are struggling to cope with the sudden and unexplained health changes in their loved ones, and the medical community is under pressure to find answers and solutions. This isn't about being anti-vax. It's about listening to people who say they're suffering. The voices of those affected are growing louder, demanding attention and action. They are not against vaccines. They are advocating for recognition and support for their health issues. People like Lindy Ayers, a young woman whose life took a dramatic turn after receiving her COVID-19 vaccine. Lindy was once an active and healthy individual, but now she finds herself battling a range of debilitating symptoms that have left her unable to work or enjoy her daily life. Her story, and others like it, deserve to be heard. These individuals are coming together, forming support groups, and sharing their experiences in the hope of finding answers and solidarity. Their stories are a testament to the need for further investigation and understanding. This isn't just about individual stories, though. The Yale study points to potential biological mechanisms behind these reported health issues. Researchers are delving into the data, examining possible links between the vaccine and the onset of these symptoms. They are exploring how the immune system might be reacting to the vaccine in unexpected ways. It's a call for serious investigation and a reminder that science is an ongoing process of discovery. The scientific community must remain open to new findings and be willing to adapt their understanding as new evidence emerges. This study is a crucial step in that direction, highlighting the need for continued research and vigilance. We need to talk about this. We need to listen to those affected, support further research, and foster a climate of open and honest discussion about vaccine benefits and risks. Only through transparent dialogue and rigorous scientific inquiry can we hope to address the concerns raised by this study and ensure the well-being of all individuals. Lindy Ayers was a picture of health. She was the embodiment of vitality, always on the move and never one to sit still for long. An avid hiker and runner, she was living a full and active life. Her days were filled with the joy of exploring nature, feeling the wind on her face and the ground beneath her feet. Then came the vaccine. Shortly after receiving it, Lindy's health began to deteriorate rapidly. Debilitating fatigue set in, a fatigue so overwhelming that even the simplest tasks became monumental challenges. She experienced excruciating muscle pain and joint inflammation. Every movement was accompanied by a sharp, relentless pain that made her once effortless activities seem impossible. Her once sharp mind became clouded with brain fog. Tasks that required concentration and mental clarity became frustratingly difficult, leaving her feeling lost and confused. Lindy was forced to abandon her job and her active lifestyle. The career she had worked so hard to build and the hobbies that brought her joy were now out of reach. Her life as she knew it was gone. The vibrant, energetic woman she once was had been replaced by someone she barely recognized.
My doctors were baffled. They ran countless tests, but the results were inconclusive. They struggled to explain my sudden decline. Each visit ended with more questions than answers. Many dismissed my symptoms as anxiety or stress. It was disheartening to feel like my concerns were not being taken seriously. But I knew something was terribly wrong. This was not just in my head. My body was failing me in ways I couldn't understand. I was living in a body that felt like it was betraying me. Every day was a struggle, and I felt isolated in my suffering.
Lindy's experience is tragically not unique. Across the globe, many others have faced similar health crises. Thousands of people around the world report similar stories of debilitating health problems arising after COVID-19 vaccination. These stories are often met with skepticism, leaving sufferers feeling alone and unheard. These individuals, often dismissed and disbelieved, are bravely sharing their stories in the hope of finding answers and support. They come together in support groups, seeking solace in shared experiences and advocating for more research and understanding. Their courage to speak out is a testament to their resilience. They are not just fighting for their own health, but for the recognition and validation of countless others who are suffering in silence. The medical community is beginning to take notice, with researchers delving into these cases to uncover the underlying causes and potential treatments. There is hope that through continued advocacy and research, answers will be found, and those affected can reclaim their lives. Lindy and others like her are not giving up. They are determined to find a path to recovery. Dr. Trevor Keyler, a respected physician, never imagined he would become a patient struggling with a mysterious illness. After his COVID-19 vaccination, Dr. Keyler began experiencing a cascade of perplexing symptoms. Severe neurological issues arose, including tremors and difficulty with coordination. He suffered from debilitating fatigue and cognitive impairment. The very doctor who had dedicated his life to healing others was now grappling with his own failing health.
My medical training gave me a unique perspective on my condition. I knew my symptoms were not psychosomatic. I understood the complexities of the human body and the potential for vaccines to trigger adverse reactions.
Dr. Keyler's story highlights a disturbing trend. Even medical professionals are not immune to these post-vaccination health issues. His experience underscores the urgent need for the medical community to acknowledge and investigate these cases thoroughly. One of the most heartbreaking aspects of this emerging health crisis is the struggle for recognition faced by those affected. Many individuals experiencing post-vaccination syndrome report being dismissed by their doctors, their concerns minimized or outright ignored. This lack of validation can be incredibly isolating and distressing. Imagine being struck down by a debilitating illness, only to be told it's all in your head. This is the reality for countless individuals who are suffering in silence. The reasons for this dismissal are complex. Some doctors may be hesitant to acknowledge potential vaccine-related complications for fear of fueling vaccine hesitancy. Others may simply be unfamiliar with this novel condition and its constellation of symptoms. Whatever the reason, the consequences are clear. A growing population of individuals suffering without adequate medical care or support. This is unacceptable. We must do better. The stories of Lindy, Dr. Keyler, and countless others are not isolated incidents. These are real people with real lives that have been dramatically altered. Their experiences are echoed by many others who have faced similar challenges. Erica Evers, a vibrant young mother, found herself battling debilitating fatigue and neurological problems after her vaccination. Her days, once filled with joy and energy, are now overshadowed by constant exhaustion and confusion.
I was always active and full of energy. But after the vaccine, I could barely get out of bed. My life has changed in ways I never imagined. Simple tasks have become monumental challenges. It was like my body just stopped working the way it used to. I look at my hands and wonder why they don't respond the way they should. Everyday activities that I took for granted are now sources of frustration and despair.
Cari Ponce de Leon, a former athlete, experienced severe heart inflammation and chronic pain. Her athletic career, once a source of pride and accomplishment, has been abruptly halted.
I used to run marathons, but now I struggle to walk up a flight of stairs. The contrast between my past and present is stark and heartbreaking. Each step is a reminder of what I've lost. The pain is constant, and it's hard to see an end in sight. It's not just physical pain, but emotional and mental anguish as well. The uncertainty of my condition adds to the burden.
These individuals from all walks of life share a common thread. Their lives have been upended by unexplained health issues following COVID-19 vaccination. They come from diverse backgrounds, yet their stories are strikingly similar. They are not anti-vaccine activists. They are ordinary people who trusted the science and did what they believed was right for their health and the health of their communities. They are teachers, nurses, parents, and friends who are simply seeking answers and support. Their professions and roles in society highlight the widespread impact of these health issues. Their stories, while heartbreaking, are powerful reminders that this is a real and growing problem. The emotional toll is evident in their voices and faces as they share their experiences. We cannot afford to ignore the human cost of this emerging health crisis. The collective pain and suffering demand our attention and action. It's time to move beyond anecdotal evidence and delve into the science. Researchers and scientists must work together to uncover the underlying causes and find solutions. The Yale study provides a crucial starting point for understanding the biological mechanisms that may be driving these adverse reactions. This research is essential for developing effective treatments and preventive measures. Community involvement and open dialogue are key. By sharing their stories, individuals like Erica and Carrie are helping to raise awareness and foster a supportive environment. Support groups and community meetings offer a lifeline to those affected. They provide a space for sharing, understanding, and healing. Medical professionals play a critical role in this journey. Their empathy, expertise, and dedication are vital in addressing the needs of those suffering from these unexplained health issues. Advocacy for research funding and policy changes is essential. The voices of those affected must be heard to drive meaningful progress. Ultimately, the goal is to restore the quality of life for those impacted. Every person deserves to live without the shadow of chronic pain and uncertainty. There is hope on the horizon. With continued research, community support, and advocacy,